it's time for us to have a conversation on prostate cancer. So to guide us in this conversation, we have representatives from the Belmopan branch of the Belize Cancer Society. We have Dr. Hart Gillett. He's joining us via Zoom as well as Mr. Rodney Neal. Good morning, gentlemen. Let me just check in with Dr. Gillett. How are you today, Doc?
Good morning. I'm doing well. How are you guys?
We're good. We're excited for this conversation. Mr. Neal, how are you?
I'm doing fine, thank you.
Great. We thank you so much for you joining us today to have this conversation on prostate cancer, which is something that a lot of men would shy away from. And of course, we need that information for us to say, I can see why it's important for me to go about doing it. And of course, give us the guidance to how we go about doing prostate checks so men can, get off that fear and be encouraged to go ahead and do their checkup. So it's definitely a conversation that we should have. Ren, let's get started.
Of course, let's get started. And so, gentlemen, I know we talk about prostate cancer and all the ideas, but before we get into what prostate cancer is, could you tell us a little bit about the idea of getting a checkup first? Because I want to go into, before we even get to the stage, I know they always say how that prevention is better than cure, being able to early detect what happens. And so because you want to early detect, that means you have to be getting your checkups. So could we talk a little bit about the process of a checkup? Kevin said something very interesting. I think there's a fear when it comes to getting checked up because you're wondering, will they tell you that I have something? And so it's scary to know that, getting that checkup, I can be pronounced that I have prostate cancer, I'm in the stage 1, whatever it is. So could you tell us about that process of getting checkup? What necessarily happens? What can people look out for? And also, why is it important to get that checkup and how regularly?
Okay, so thank you for having me.
Good morning, Renata. Could I just come in quickly here, Doc?
Sure.
Renata and Kevin.
Sure.
Good morning on behalf of the Belmopan branch of the Belize Cancer Society. I do know that we have limited time, and most of it, I think, will be devoted to Dr. Gillett. So before he gets on his run, just let me say that we are very pleased to be here. And yes, indeed, the questions that you have put forward are questions that we intended to address, particularly Dr. Gillett. Of course, one of the main things that we are here on is to promote the idea of, or the fact that, in fact, we are providing through 3 laboratories, medical laboratories here in Belmopan, we are providing discounted rates for PSA tests. And I don't know if you'd want me to get into that now or Renata.
But by all means, you can speak about that first, yeah?
Yep.
Yeah. Let me just say that the Belize Cancer Society is recognizing and observing April this month as Prostate Cancer Awareness Month. And we are partnering with the local hospitals in Belmopan to offer discounts for those suffering from cancer or wishing to know the status of their prostate in this month. Because even
I think we're having...
After one is diagnosed, and one still has to PSA test, which Gillett will get into. Hello?
No, sorry, we lost you just for a second, but you can continue. Your net has been restored.
Okay, fine, thank you. So the discounts that are being offered are from 3 laboratories. The St. Luke Hospital Laboratory, which is offering discounted rates down from $60 down to $54. Garden City Medical Center, which is discounted from $50 down to $40, and Belmopan Medical Center, which is discounting down to $45. This is for the month of April, and there are no pre-requirements, no pre-qualifications, regardless of where you are from. The fact is matter, once you go to one of these laboratories, you will be able to get this discounted rate this month. And hopefully after you do that, you will continue with your tests, because it's a matter of not just one test, but a series of tests over a period of time.
Great. Thank you, Mr.
I'm
Neil.
hoping to go back. I'm hoping to get back to this afterwards, but I'll let Dr. Gillett come on now to answer the questions that Renata put forward initially.
Great. Thank you. Thank you for giving us that information, Mr. Neil. All right, Dr. Gillett, you can go ahead.
So, good morning. Thank you
Good
for
morning.
having us. There was a PowerPoint slide that I had sent, which just visualized to give people more or less an idea.
Okay, yeah, we have it.
What it is, what we're the information that I want to share with people, because I think you said spoke about one of the fears that men have about getting checked. The thing is, I think a lot of men still think that using a finger is the way we check the prostate, no?
Yeah.
Although a digital rectal examination is a part of the physical examination, it's not something that primarily has to be done anymore. You see, the PSA stands for prostate-specific antigen. It's a protein that's made by the prostate, and that number in your blood can go up depending on what is affecting the prostate. From benign enlargement, just the natural growth of the prostate, that number goes up a little. If there is inflammation of the prostate, such as prostatitis, that number goes up a bit more. And in the cases of cancer, that number can climb quite significantly. So the PSA is one of the screening tools that we use. By all means, it's not the only thing that we should be using. It goes all hand in hand with the interview of the patient to see what sort of symptoms they have, if it is their prostate that's their main issue. An ultrasound can also be used to determine the shape and size and consistency of the prostate to see if there's any other issues. And of course, the physical examination of the patient as well, no? The routine screening should be done for all men starting at the age of 50. We have certain cases where we lower this down to about 45. In the case that the patient, the person of interest, has a family member, what we call a first filial, a father, a brother with prostate cancer, or if they've had two close relatives, such as uncles and aunts, who have this issue. If cancer runs in the family, then we lower that number down as well.
All right.
But yearly checkup.
Okay, so I was just about to ask, what are risk factors for prostate cancer for men? And you're saying it could be hereditary, so if it's within your family that somebody has experienced prostate cancer, then it can trickle down to you. Are there other risk factors that you can share with us that men should be looking at and be like, okay, I need to go and get checked?
Okay, so in the case that the most notable risk factor is, of course, genetics. If you have a family member with a history of cancer, any type of cancer, but if you have prostate cancer specifically, that puts you at higher risk group, and so you should get your prostate checks earlier. But what we want to encourage is really and truly all men at the age of 50 should get their yearly blood test done, their PSA checked. Things that increase your risk of cancer are, the same thing that increases risk for all cancers, actually, is excessive consumption of tobacco, alcohol, poor lifestyle choices, that sort of thing. Okay, but the mainstay is if you have a history of that, you particularly need to go get yourself checked. And all men, regardless of lifestyle or risk factors, should get themselves screened as well with a PSA blood test.
Doc, I have an interesting question here, and this comes from one of our viewers, and the person is asking, so what about men that engage in anal sex? What are the risk factors there, and when should they get checked for prostate cancer?
Interesting question.
Yeah.
It doesn't put you at more risk at all if that is their sexual orientation. That has not been proven to have any bearing whatsoever on increasing the risk of prostate cancer. No. So again, all men, just being male and being 50, get it done.
All
yearly.
right. Okay, thank you for that. So I'm in my 30s, I am safe. So until I get 50,
or 45 too as well, because remember they did mention if you have a history of cancer in your families, specifically if your uncle or so has gotten prostate cancer, that you should also be taking it a little bit early at 45.
There you go.
So that is actually something for our viewers to just take a point on. And also have the conversations with your doctor. I think it's really great that Dr. Jilly was talking about how the necessary finger is not always the
Index
case.
finger, yeah.
Yeah, the index finger is not always the case of how we check. And so I think a lot of people have that perception that that's gonna happen. And so there's that fear, like, I don't want anyone to touch me there and I don't wanna deal with this uncomfortable process. But
Right.
if they understand the different options, and right now, again, for the month of April, there is a discounted rates for 3 different locations where you can be able to go and check yourself. And so again, for people that are 45 to age 50 and above, you can be able to see there are different options where you can just go in and get your check to just see where you stand when it comes to your prostate.
Yeah. Dr. Gillette, I have a question. So for us young men that are not 50 yet, what can we do to prevent prostate cancer?
So one of the mainstay things, we categorize, risk factors into 2 things: those that can be modified and those that you cannot modify.
Okay.
Things that you cannot modify, such as your age being male, the fact that you get older every year cannot be changed, or your genetics, the fact that you have a history of cancer. The ones that you can modify is do not smoke. That increases your risk for pretty much all cancers, including prostate cancer as well.
And this is smoked tobacco?
Tobacco smoke specifically. It's produces carcinogens. It increases your risk not just for prostate cancer but colon cancer, lung cancer, of course, and mouth cancer. So that just poor lifestyle choices in general, toxic habits such as excessive smoking, drinking, do have that increased risk. And so by eliminating those from your life, you can have that. Also, having a healthy sexual
lifestyle.
Lifestyle, yes.
Yeah.
Also, reduces that risk as well.
What do you mean by that, though? Because
Okay,
I read in some posts that there's a certain number of ejaculations you're supposed to be having per week to ensure that you have a healthy prostate.
I think that makes it
so what
so
do you mean by a
specific.
healthy? Yeah, right. I was blown. So what do you mean by a healthy sexual lifestyle, Doc?
So one of the main reasons that this is a thing is because, medically speaking, the tubes from the tip of the penis upwards can end up with bacteria. It ascends this part, which is why drinking water regularly is so important. You keep flushing out those germs out the tubes. So same thing for ejaculations. You kind of clear the pipes of infection, and so it decreases your risk of recurrent prostatitis. And so by that means reducing your risk for prostate cancer down the line as well.
There you go, Red. So ejaculations is a healthy way of keeping that prostate. Is there anything about the diet? Because I read that tomatoes help with the prostate. Is that true?
So in general, once you have natural tomatoes or fruits and veggies, those are always going to help promote a healthy lifestyle and reduce your risk of cancer. One of the things that we would ask people to stay away from is mostly processed foods. A lot of foods have preservatives and actually carcinogens, especially canned foods. Particularly have a lot of carcinogens. So while not directly linked to prostate cancer, it increases your risk for cancer in general. So the fresher foods, meats from your butcher directly is going to be able to help reduce that risk. Just stay away from canned stuff and prepackaged foods, processed foods. It reduces your risk as well.
Great, thank you for
Mr.
that.
Neil, I know you were mentioning about the different discounts and also the different laboratories. Did you have a number that people can be able to contact to make an appointment? I know you mentioned, that all of these places are having different prices for the discount. So people maybe they say, I want to go to the $45 one because it's cheaper than I go to the other one or sort of $54 one or whatever it is. Could you give us some numbers that they can be able to go and call, or is there a Facebook page as well that has up the discounts that people can know exactly where to go? Because maybe somebody from Orange Walk is traveling down and they want to be able to, make that link. So could you provide those for us if you have?
Unfortunately, Renata, I don't have that at hand immediately, but all these 3 laboratories are in the phone book, right? So, and I know Dr. Gillett can give you the one for St. Luke Hospital because he actually is, he works there now. But St. Luke Hospital is the 10% discount, taking it down from $60 to $54. The Garden City Medical Center is on Slim Lane in Belmopan, Slim Lane. That is just behind Print Belize.
Yes.
And Belmopan Medical Center is on Garbot Street. All right. And that's just off the Constitution Drive.
Yeah, it's close to
Unfortunately,
safe.
as I said, I don't have the numbers, the phone numbers, but they can be obtained from the phone book.
Great. So thank you so much for giving us that information about where the discounts are at, and Dr. Judith for enlightening us on the prostate cancer. So I hope that your conversation and the information you shared help to address those fears and those uncertainties within men. And also for their female partner, their partners, to encourage men
And I
to
was
go
just gonna
ahead
say
and
that.
get checked.
I think
Yeah.
women, you'd also have a vital role to play too as well by encouraging your husband, encouraging your partner, whoever it is, your friends, your brothers, and let them know you're at age 45, you're at age 50. Don't you think it's time now that you go and check up yourself? There are discounts for this entire month of April, numerous different spots that you can be able to go and check out from. If you're planning to travel or so, go out and check. It will not hurt you at all. In fact, it will actually give you information to know how you can better equip yourself for your health, and so you can better be able to provide for your family and just be able to have a healthy lifestyle. So by all means, I encourage everyone out there to go and do your checkups. All these males at 45 to depending on 50 and above, make sure you go and check out. So with that, we thank you so much again, gentlemen, for being here, for giving us the great news of the discounts and also the updates of why it's so important. And of course, the fact that the fear of that whole index finger thing can be thrown out the door because there are other methods in which we can do. Stay away from tomatoes. Is that what you know?
Eat your tomatoes.
Oh, eat your tomatoes and mind your own business. Okay. But make sure you stay away from smoking tobacco. Yes, and processed food. Okay, I got that one correct. And so
Good job.
with that, we go to our next commercial break. But when